My question is to the Premier. Niagara has the third oldest population by average in the entire country, and our seniors are at greater risk of getting COVID-19. Given the over 200 outbreaks and more than 360 deaths we've had across the region, Niagara is a high-risk zone. It makes sense that we be given our fair share of all available COVID vaccines. Yet in early January, we found out that 5,500 doses of life-saving Moderna vaccine promised to public health was sent elsewhere at the expense of healthcare workers and seniors. Mr. Speaker, my question is the same question that our doctors, public health, Niagara Health, healthcare workers, and the residents are asking this Premier. Where were our vaccines sent, and why were they diverted? And will he immediately send Niagara its fair share of both vaccines?
Government House Leader.
Sorry, Mr. Speaker. The member will know that that actually is not the case. As the Minister of Health highlighted the other day, all regions are getting their fair share of vaccines. There was obviously in our vaccination plan, we highlighted or focused on congregate care settings, long-term care homes, retirement homes, and we were making sure that the vaccines were in place to cover all of those people in those settings, including healthcare workers, Mr. Speaker. There was a switch between Moderna vaccine and Pfizer vaccines, but at no time was Hamilton or was Niagara shortchanged of any vaccines, Mr. Speaker. And I completely reject what the member is saying. It is a dangerous thing for the member to be saying. We should be all working together to make sure that we all get vaccines and help in defeat COVID-19, not spreading false allegations, Mr. Speaker.
Member to withdraw. Supplementary question.
Thank you, Mr. Speaker. And it is absolutely accurate. Yesterday in this House, the Minister of Health said, when referring to COVID-19 vaccines, I can assure the member opposite that Niagara did receive its fair share. Niagara doctors disagree. In a letter to the Premier, asked for our, and I quote, fair share of vaccines. Is the Minister saying our healthcare workers aren't being honest? The doctors also said our teams are burnt out. People are worried for their loved one. They need hope, and hope was the vaccine that offered. It doesn't make sense that life-saving doses of vaccines were diverted from the Niagara region. In 1 month, hundreds of seniors died in Niagara, and there is a death every 3.5 hours over a 7-day period because we didn't get our vaccines. When will this government be open and transparent with the people of Niagara and let them know where the much-needed vaccines were diverted to? And it is accurate.